Internationally, lung cancer continues to be the leading cause of cancer-related deaths in men and women today. Reliable sources show that lung cancer is the second commonest cancer among males in Sri Lanka and that the poor survival of it was due to the advanced stage at diagnosis. Cancer of the lung is a disease of middle and late life with peak incidence in 55 to 65 years of age. This is why patient education and streamlining of diagnostic pathways are needed to improve outcomes in these patients. Out of the number of benign and malignant tumors that occur in the lungs, the primary lung cancer, commonly termed bronchogenic carcinoma, is the most common one. In the aspect of pathology, there are 5 main histologic types of lung cancer. They are squamous cell carcinoma, large cell carcinoma, adenocarcinoma, small cell carcinoma, and combined squamous cell carcinoma and adenocarcinoma. Out of all the 5, squamous cell, large cell, and adenocarcinoma are further categorized as non-small cell carcinomas. Adenocarcinoma is reported to be the most frequent histologic subtype of lung cancer, accounting for almost half of all lung cancers. Squamous cell carcinoma is the most common histologic subtype of bronchogenic carcinoma, found more commonly in men, often with a history of tobacco smoking. These tumors usually arise in a large bronchus and are prone to massive necrosis and cavitation. They are microscopically identified by either intercellular bridges or keratinization, varying histologic grades of differentiation, and a more rapid spread compared to the other types. Small cell carcinomas are highly malignant tumors that frequently occur in the hinder or central region of the lungs, and they have a strong relationship to cigarette smoking. Adenocarcinoma is a peripheral carcinoma that occurs mostly in women. It is slow-growing and is called a sear carcinoma due to its association with areas of chronic scarring. The recent estimates place this as the most frequent histologic subtype of lung cancer. Large cell carcinomas are undifferentiated carcinomas which are highly malignant tumors. They occur commonly in men, having a strong association with cigarette smoking. Adenosquamous carcinoma are small proportions of peripheral scar carcinomas having clear evidence of both keratinization and glandular differentiation. Clinical signs and symptoms: persistent cough, chest pain that worsens with deep breathing, coughing or laughing, dyspnea, coughing up blood, shortness of breath, wheezing, fatigue or weakness, fever, cough with sputum, unexplained weight loss, loss of appetite, hoarseness, frequent lung infections, swelling in the face or neck, bone pain if the cancer has spread, headache or dizziness. Diagnosis of lung cancers can be carried out by a thorough medical history and physical examination by the doctor. Imaging tests such as chest X-ray, CT scan, PET scan and MRI, sputum cytology, biopsies such as bronchoscopy, needle biopsy, thoracentesis and surgical biopsy, molecular and genetic testing, and finally the staging test. As commoners, we may not know what histopathology is, but it is worth to know it as lung cancer is a disease burden of today. So what is histopathology? It is a study of the diseases that affect the tissues by examining tissue samples under a microscope. It is the key part of cancer diagnosis that helps to identify the type of cancer and its grade. Histopathology mainly concerns tissue biopsy and microscopic examination. A tissue biopsy is the most common way to confirm the presence of cancer, where a sample of lung tissue is obtained from the lungs and sent through several preparation steps such as fixation, embedding, sectioning, and staining. Microscopic examination is a critical step to diagnose particularly the cancers. It will help to differentiate the normal cells with abnormal cells, specific cell types, type and grade of cancer, margins of tumors, staging of cancer, identification of infections, any genetic abnormalities, and tissue damage or inflammation. The widely accepted clinical staging of lung cancer is the TNM classification, where it consists of 4 stages, namely occult, stage 1, 2, and 3. Prognosis is a medical prediction of how a disease or injury will develop over time, and this says that adenocarcinoma and squamous cell carcinoma has a slightly better prognosis as they are localized and can be resected, while small cell carcinoma shows the worst prognosis.